Today we're going to be talking about alopecia areata. That's right, this is a cause of hair loss in some people. Now, I've done videos on hair loss before, and we've talked about the fact that hair loss can be caused by a number of different underlying conditions or behaviors, etc. Okay, even medications can cause hair loss. Alopecia areata is one potential cause. And by the way, there are different types of alopecia as well. So I'm going to explain what alopecia areata is. I'm also going to show you some photos as well so you can get a sense of what's going on. I think this is a really important condition to talk about. Hair is something that's very important to us. It's very important to probably most all of us. It can be devastating when we lose our hair for whatever the reason. Let me show you a picture of somebody with alopecia areata. As you can see in this photo, the person has hair, but there is sort of this circular area of this patch where there is no hair. It's a circular patch. There are other photos as well where people have sort of patches of lack of hair on their scalp. Now, a few things about this, by the way. Alopecia areata does not just have to happen on the scalp. Let me give you a few details. First of all, alopecia areata, we believe, is a chronic autoimmune disorder. Autoimmune disorder or disease basically means that the body mistakenly attacks itself. The body thinks that itself is some sort of intruder or bad thing, so it attacks itself, and that's what we believe is the cause of alopecia areata, okay? What it causes is non-scarring, patchy hair loss, kind of like what you saw in the photos I have just shown. Usually it's the scalp and the beard, but honestly, you could have hair loss anywhere, to be honest with you. I talked about the nature of the hair loss for alopecia areata being patchy. It's usually patchy, round patches of complete hair loss in normal looking skin, okay? So that's something that you've seen as well. But there are also more severe forms of alopecia as well. There's forms of alopecia that causes total loss of scalp hair, total loss of hair on the entire scalp, total loss of scalp and body hair as well. So there's different versions, different forms, okay? This is the thing. There are a number of treatments that a dermatologist may consider for treating your alopecia areata if this is you. That's important for us to know. Alopecia areata in particular most commonly happens in people younger than 40 years old. And in fact, 50% of people who get it are actually less than 20. It is rare in kids less than 3 years old, however. The prevalence is equal in men and women. Some conditions we see more in women than men or vice versa, but that's not the case here. And it's the most common cause of inflammation-induced hair loss. About 0.1 to 0.2% of the general population has alopecia areata. There are a few risk factors, okay? If you have a personal or family history of alopecia areata, that is a particular risk factor for this. If you have a history of something called atopic dermatitis, or if you have other autoimmune disorders, okay? This condition, I believe, is really important to talk about, just like so many other conditions we talk about, right? But as I mentioned before, hair loss in particular can feel very, very personal. It's one of the things that people first see about us. It's one of the things that we first see about us. And it's one of the reasons why I wanted to talk about this. If you have hair loss for any particular reason, whether you think it's alopecia or something else, you really should get it checked out. Why? Because, well, number one, you deserve the opportunity to understand what's going on with your body, and also the opportunity to see if there are treatments and ways to sort of improve what you're seeing, okay, with your hair. So I want to encourage you. This is always, my videos are always about not necessarily having you diagnose what's going on with yourself and make yourself crazy about what's going on and what's not, but it's to let you know that, you're really your best advocate, okay? And no one sees you more than you see yourself. So if you've noticed things with your hair, whether it's hair loss or other changes in your hair, it's a reason to see your doctor. And in the case of hair loss and alopecia and other hair conditions and skin conditions, our dermatologists really are our best friends. You can certainly start with your family doctor. Oftentimes we start with blood work. We start with things to get you ready. We refer you on to dermatologists, but dermatologist really is where it's at. So I'm so appreciative for my dermatology colleagues for all that you do in this area and so many others. Let me know if you've dealt with hair loss of any type, what things have helped you, how you have dealt with it. I certainly have family members that are dealing with hair loss right now. I've had periods of hair loss myself. I've actually talked about that in some of my videos. It can be a very, very big thing. So if this is what you're going through, please understand you're not alone. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of stuff. Please like and follow my page if you have not. And for those of you who send stars, I respond to you personally. Also, consider joining my subscription group, Dr. Jen Superstars. Guys, I'll see you soon.